Hello, my name is David Bohl. I'd like to talk to you today about recovery management services for those individuals facing substance use and/or mental health challenges. First, a little bit about myself. I'm a clinical substance abuse counselor licensed by the state of Wisconsin, a CSAC. I'm a master addiction counselor credentialed by the National Association of Alcoholism and Drug Abuse Counselors. I'm an independent addiction and recovery management consultant at my private practice, Beacon Confidential LLC, as well as an independent separation, relinquishment, and adoption consultant through the same firm. I'm a two-time author, first the author of a memoir, Parallel Universes, The Story of Rebirth, and I'm a co-author of the monograph, Relinquishment and Addiction, What Trauma Has to Do with It. I've spoken on the topics of addiction and recovery management and that intersection between mental health challenges, including adoption, separation, and addiction at numerous conferences and virtual events over the years, including some keynotes. I'm a member of the National Association for Alcoholism and Drug Abuse Counselors. I'm a previous board member and addiction and recovery consultant to the National Association of Adoptees and Parents, and I'm currently an advisory board member of Wisconsin Adoption and Permanency Support. Personally, I enjoy spending time with my wife of 38 years and my adult children, and I relentlessly pursue Blue Mind, which is that calm and peace or that sense of general happiness that comes from being in or around the water. And I mostly do that near my home, but I do that wherever else I could find it. So today, as I told you in the beginning, I'm here to talk with you about a unique approach to helping individuals that we know in solving problems in our community. And there's a lot of ground to go over on that topic, and sometimes I talk very fast for that very reason. So let's get started and let's tell you what you need to know today. And thank you for tuning into this important discussion. First, we'll describe and define the problem, and that is that we live in an increasingly stressful world. Stresses are increasing rather than decreasing, and this is for many reasons. First is effectiveness and proficiency, which are increasing at rapid rates. Currently, we have to add value if we want to succeed. So we're under constant pressure to be better or smarter or faster and more unique and to constantly, quote unquote, reinvent ourselves. And the fact is that everybody brings something different to the table. So stressing over individuality is really a misguided way to spend our time and to increase our stress. Yet we don't always feel this, and that results in distress and stress. Hand in hand with this increasing efficiency is the rate of innovation. We live in a very, very fast world where things change in a hurry. Swift innovation is great in that it can solve many problems and make life easier in some ways by addressing previously unsolved challenges, but it can also create stress since it's difficult and exhausting trying to adapt to a constantly changing world, and we feel this each and every day. Third are judgments and comparisons. They happen to be everywhere. When we compare our lives with how other people present their lives, this creates stress, or we create stress for ourselves. A comparison unto itself is not terrible, as it can help drive helpful competition and advancement, yet comparing ourselves to others is often detrimental because we tend to set unreasonable expectations of ourselves and of others. And social media, of course, is notorious for this. The things we believe we know about others are never complete through social media, and they've been carefully curated for our consumption. So what happens is these unrealistic comparisons cause us an immense amount of stress and distress. Next, more than 400 years ago, a gentleman by the name of Francis Bacon, who promoted the scientific method, said that knowledge is power. Knowledge is power. And we still have people spewing that mantra today. We also know that it's also a cause of great stress. We're inundated and deluged with data on the internet and opinions everywhere we turn. Anytime we tune into something or we're online, we're getting opinions. So what this creates is a stress and negativity that rewires our brains if we don't tune out and screen out some of the content or some of the information that we're inputting into our brain. Next, there are 330 million people in the United States and 8 billion people in the world. And what's happening is that we're becoming increasingly diverse. Now, to coexist with different people and succeed, we need to better understand their views of the world and their place in it. And when our ideals don't necessarily line up with everybody else's, or when we feel overwhelmed trying to keep up with these new individuals we're being exposed to, we become stressed. It's a natural reaction. So it's really tough to respect and celebrate diversity if we become stressed by the expectations that come with it. So we need to be aware of that. And our coping strategies for stress have become fragmented. as our relationships and our community engagements are weaker and have been getting weaker over time. In addition, health risks in today's political discourse have certainly added to all that stress. And this increasing stress means only one thing. It means that our partners and our children and our neighbors and our colleagues and our employers are struggling at increasing rates and in significant ways as they find readily accessible, unhealthy ways to deal with the stress, right? Rates of alcohol and substance use are rising at alarming rates. Overdose rates across the board, including those from heroin and other opioids, fentanyl, benzodiazepines, are at all-time highs. Clinically significant anxiety, that is debilitating anxiety and depression, are being experienced by increasing numbers of individuals. And from my experience in working with individuals, depression was a major theme in their lives up until about 5 years ago. Now, I'd say about 3/4 of the individuals I work with, their predominant struggle is anxiety, including stress and distress, panic attacks, ADHD, PTSD, and others. Sadly, suicide attempts and deaths continue to rise, and declining life expectancies in the U.S. from 78.9 years in 2019 to 77.0 years in 2020 to 76.1 years in 2021 are largely attributable not only to COVID and overdoses, but also to suicide and trauma, right? We hear a lot of talk about trauma. That abuse and neglect that people inflict upon one another is sadly on the rise. For the first time in 5 years, 2020 saw an increase in the number of victims who suffered maltreatment, even though we were making gains prior to then. And that trend continues to increase, despite the fact that we're becoming more trauma aware and we're discussing it in many more venues. And all of these are what I would call maladaptive coping mechanisms, using chemicals, behaviors. These maladaptive coping mechanisms can be caused or they can be exacerbated by stress. Now, all of these things, though immensely problematic, are not the problem. The problem that I started to define earlier. The real problem is that as these stresses and their symptoms have increased, utilization of addiction or substance use and mental health services has fallen in the past couple of years. And this, of course, is generally attributable to fears of getting sick and in-person treatment and counseling opportunities being limited by in-person disease protocols and by the industry's slow reaction in providing virtual services to those in need who may have health needs or may have geographic needs to receive virtual type services. So in addition to those stressors we discussed a few minutes ago, multiple stressors caused by today's health risks and society's reaction to it, isolation and sickness and grief and job loss and loss of routines, have devastated some of our relatives and our neighbors and our colleagues. And they have presented unprecedented challenges in accessing behavioral health and addiction services across the United States and the world. And in short, that is the problem. That is, there's an increasing number of people who struggle with substance use issues and mental health issues, and there are fewer who are getting help. And untreated mental health and substance use issues, untreated mental health and substance abuse issues result in physical, psychological, and emotional harm to individuals, as well as considerable societal costs, including increased medical care costs and medical insurance costs, higher taxes for providing emergency room services and criminal justice services, higher workplace stress and absenteeism and attrition, and liability costs to companies, as well as lost production and decreased efficiency and morale. So, wow, I think we've clearly defined the problem, and it is a serious one, and it is a broad one. The good news is, if there is good news, is that there are solutions, and there are solutions that are available to you, to those of you listening in. So let's talk about those. Certainly, our governments are spending increasing amounts of money on prevention and intervention and treatment, and that's a good thing. And it's a good thing as long as it helps solve the problem. That is, that as long as outcomes are measured and things are adjusted to make sure that the maximum outcomes are being achieved. That doesn't always happen with government, but let's be optimistic and hope that they're going in that direction. In addition, many companies have established drug-free workplace programs and or have employee assistance programs that promote education and provide counseling services, or they make referrals to therapy and or treatment. And this is a great area of support that exists for many of us. Many states and their counties provide crisis or outpatient counseling or medication management or case management and or suicide prevention services. This is very helpful as well. And there are many therapy and treatment services that are accessible through private or state insurance. One simply needs to contact his or her health insurer on the back of their health insurance card or ask one's primary care provider for a referral There should be no wrong door to entry to these types of services, so simply inquire about them. And oftentimes, these services can positively affect substance use and mental health issues in profound ways. You can hear lots of testimonies and find lots of testimonies of people who have engaged in these services and turn their lives around. And that's very positive. Yet, sometimes there are those who don't, who try to engage, and for some reason, those activities they've engaged in have not been helpful. So sometimes more is needed because relapse rates for drug and alcohol use and for mental health issues resemble those of other chronic diseases, including hypertension and diabetes, whereby an estimated 40 to 60% of individuals relapsing after treatment and after initiating recovery continue to struggle, right? They relapse. And relapse is an indicator that people need additional support or that they need to try a different approach to the issue. It's as simple as that. We try to give them a treatment plan. If it doesn't work, we need to change it, or we need to add some things that give them additional support. Now, I don't want to be critical of any therapists or any treatment providers out there. I've worked in those settings. I refer clients to those services. Many of these programs and individuals, professionals do excellent clinical work and are very much needed to address these problems. Yet, in my experience, many people need more. And the people that I work with tend to need more. For example, that old school model of addiction or mental health treatment was to stabilize the situation either through a hospital detoxification or a psychiatric hospital admission, then send the affected person away to a 30 or 60 or 90-day residential treatment program, then have them live in a supportive or sober living community for 6 or 12 or more months, and then maybe transition them back into their home communities. Yet that does not work for many of the people that I work with. First off, private insurance has been increasingly reluctant to pay the high costs associated with residential treatment and the supportive living model of care. Second, many of the people I work with are unable to check out of their current lives to go away for extended periods of time. And their families and their colleagues and their employers need them back home and at work and functioning efficiently as soon as it's safe to do so. So ultimately, what we're talking about today, recovery management, and what I do and what I provide to my clients, individuals, families, organizations, is that recovery management approach to addiction and mental health issues. And let's talk about that. Recovery management is about organizing assessment and treatment and recovery support services so people with addiction or mental health issues can get ready for recovery, so that they can get into recovery, so that they can get through early recovery and the drama involved in that and the significant changes that need to be made, and that they can thrive in long-term recovery. Put another way, recovery management is about reducing harmful alcohol and drug use and mental health symptoms to levels where they're no longer causing negative consequences. It's also about working with families and working with colleagues and employers and employee assistance programs and other therapists to give individuals the tools they need to better support their wellness goals and they're increasing their overall wellness. And this is a recovery model that's needed because the chronic nature of addiction and mental health issues requires ongoing engagement to ensure that people are supported throughout the duration of their recovery, from their investigation to their initiation to maintenance of healthy behaviors. Recovery management services have been shown through research to have significant positive impact on abstinence rates, reduction in mental health symptoms, and increase in quality of life for individuals. So operationally, let's talk about what that means. Here's what it might look like to a client or a family and organization. We would start with a consultation, and where I would meet with the client and or their family and or their colleagues to understand and assess the challenges the person is struggling with. And because of my professional personal experience with addiction and mental health issues and delivering services in this universe, I'm uniquely able to isolate and identify those problems. We'll engage in crisis intervention if it's needed, where we respond to a mental health or substance-related emergency and help the client and their family and their organization navigate those necessary steps in order to stabilize the client and make them safe so that the problem isn't increasing. Next, we'll engage in assessment, and this is always necessary, and it's an ongoing process. And what assessment does is it identifies and evaluates the client's strengths, vulnerabilities, needs, and immediate problems to figure out an action plan to best help them stabilize with the goal of moving into a longer-term solution. Then comes case management, which involves an ongoing guidance according to a planned framework. This includes helping with referrals for additional mental health or addiction treatment or services, testing, monitoring, or any other necessary steps leading to healthier behaviors, or if you prefer the term recovery, including eliminating risks in their home and their work environments, or reducing risks in their home and work environments. Next is recovery coaching, an integral part of recovery management. And this is generally indicated because recovery presents challenges that are best addressed as they occur. So coaching at regular intervals, sometimes every day, or at periodic intervals of once or twice weekly, and then coaching on demand as situations arise, delivers a solution-based plan for clients that helps them overcome challenges to their wellness goals and proposes solutions in the moment. Next, it's often appropriate for there to be family or colleague or organizational recovery coaching. And this may be needed because recovery and wellness doesn't happen in a vacuum. In order for a person to get better, they often need the support of their family and their friends and their colleagues and their employers and other significant people in their lives. And I bring these supports together, clarifying expectations for all involved, and provide everyone with the tools they need to take care of themselves first and then support the identified client. Again, serious substance use and mental health disorders are chronic conditions that can involve cycles of abstinence and relapse, possibly over several years following attempts to change. Thus, sustaining remission among those seriously affected typically requires a personal program of sustained recovery management. That's what we're talking about today. That's what I have expertise in. That's the service I deliver to my clients. And again, recovery management works to identify and alleviate problems before they derail healthy choices or do they derail recovery, and to facilitate rapid re-engagement and more structured treatment or recovery supports if recovery at any time falters. Now, there's a growing body of research that proves that recovery management is very effective. We talked a little bit about it earlier. Now, here's some more. Research proves that recovery management improves engagement in the process, engagement in change. Research also shows that individuals receiving these services return to treatment sooner after they relapse. They had fewer misuse problems. They had more days of abstinence and overall wellness, and they were less likely to need treatment and follow-up 2 to 4 years later. Recovery management has also been shown to be very effective for people who have co-occurring substance use disorders and mental illnesses like anxiety and addiction, or depression and addiction, or trauma and addiction. And lastly, recovery management is very cost effective. Now, although recovery management adds somewhat to the care costs, and they are not currently covered by insurance, and we need to change this given that recovery management works and is proven to work, studies show that recovery management produces greater reductions in overall costs associated with healthcare and criminal justice. So that's the operational side of recovery management. Now you ask, great, now David, how do you do it? How do you do it differently? Well, I bring both my clinical experience and a wealth of resources and connections to bear upon a person's care, as well as personal experience and success in overcoming and managing these issues. That means I've been both a provider and a consumer of treatment services, and I've been both a provider and a consumer of recovery management services. So I know where individuals are in this, and I've worked in clinical treatment. So I thoroughly understand that valuable part of the solution. I was previously the director of addiction services for a nationally prominent Rogers Behavioral Health, whereby I oversaw a large national team and continual care focused on co-occurring mental health and addiction issues. I was the executive director of an outpatient treatment center in Lake County, Illinois, and I served as director of recovery management services for the Hazel and Betty Ford Foundation in Chicago, as well as providing recovery management services for the past 13 or more years. And ultimately, I understand people and how to help them work through their challenges. That's what I do. I hope that that this information has been useful to you. Should you have any more questions, or if you'd like to get started working together, please contact me at beaconconfidential.com, BEACON confidential.com, or David at beaconconfidential.com. I look forward to hearing from you.